Individuals over 60 engage in a nightly activity that may silently elevate their stroke risk, without pain or prior indication, during sleep. Absence of chest discomfort. Speech is not slurred. Absence of dizziness to signal you. You retire for the night feeling quite well. By daybreak, a transformation has occurred. You awaken disoriented, unable to articulate coherently, or unable of raising your arm. A cerebrovascular accident. Quiet, abrupt, and transformative. All due to a factor as elementary as your sleeping posture. As a neurologist, I have encountered this phenomenon excessively. Not due to smoking, poor food, or insufficient exercise, but rather due to prevalent sleeping practices that many seniors consider to be safe. They are not. Today, I will elucidate 9 perilous sleeping positions and nocturnal habits that may elevate your risk of stroke, cerebral hemorrhages, or hypertension, particularly during the tranquil hours when your brain is most susceptible. This film may be life-saving for individuals over 60 or their loved ones. Possibly even yours. Therefore, do not avert your gaze. Commence. Prior to commencing, if you have not yet subscribed, I suggest you activate that button and enable notifications to ensure you do not miss any health advice tailored for you. If you appreciate this video, please enter 1 in the comments. If not, please enter 0 to indicate how I might enhance the content for you. 1. Reclining supine without a cushion. Supine cranial alignment. It appears innocuous, even reassuring. Reclining supine at night, arms positioned beside the body, devoid of a pillow beneath the head. For numerous elderly individuals, it is a practice that commenced decades prior. It is claimed to alleviate back discomfort. Some individuals perceive it as expanding the chest. However, this is information that is seldom disclosed. Resting supine without head elevation may covertly heighten your stroke risk during the night. You may never anticipate it. When you lie supine, your head aligns horizontally with your heart. While it may appear natural, it is not biologically accurate. Particularly not in elderly individuals. As we age, the veins in our neck and brain diminish in flexibility. Circulation is compromised. The veins responsible for draining blood from the brain must now contend with gravity. This implies that rather than flowing seamlessly, blood may accumulate, decelerate, and potentially coagulate. Particularly during the early morning hours when blood pressure inherently increases. Blood clots that develop during sleep do not remain dormant for an extended period. A minor thrombus in a constricted vessel. The repercussions can be catastrophic. Impaired articulation. Facial ptosis. Chronic impairment. Including death. I wish to inform you about Mr. Leonard Whitaker, a 77-year-old retired mechanic. Hailing from Michigan. Robust, autonomous, stationary lawnmowers in his garage. Each night, he reclined horizontally in bed. Absence of a cushion. Only the mattress. With his hands clasped upon his breast. A habit acquired during his service in the Navy. He stated it facilitated profound sleep. One morning, his wife Mary discovered him semi-conscious yet unable to articulate. His eyes were open, although one side of his face had sagged. He was unable to elevate his right arm. A scan at the emergency room revealed a thrombus in the left middle cerebral artery. A form of ischemic stroke that occurs when blood coagulates and forms clots within constricted vessels, frequently during sleep. His carotid arteries exhibited rigidity. The blood had accumulated excessively, directly attributable to his sleeping posture. The physicians acted swiftly to remove the thrombus, however Leonard never fully returned to his previous state. His discourse has become more deliberate. He utilizes a walker. Each night, Mary meticulously positions him on a wedge pillow, an item they both regret not discovering years prior. Many individuals fail to comprehend that lying flat, particularly due to age-related vascular alterations, impairs venous outflow from the brain. This is the medical terminology for this. The cerebral circulatory system deteriorates, leading to stagnant blood that may foster clot formation. Incorporate natural nocturnal dehydration and reduced oxygen saturation, and you have an ideal confluence of adverse conditions. This position poses significant risks for seniors with hypertension, atrial fibrillation, sleep apnea, a history of carotid artery disease, or those using blood pressure drugs that may cause excessive nocturnal hypotension. The most secure modification? Elevate the head slightly to an angle of around 30 degrees. It facilitates gravitational assistance in blood circulation, decreases intracranial pressure, and enables more uniform oxygenation of the brain. Even a single or a pair of supporting pillows can significantly impact comfort. Select a pillow that maintains the natural curvature of the neck, avoiding one that causes the chin to tilt forward. Some individuals believe this pertains solely to comfort. It is not. It pertains to the circulation of blood to the most sensitive organ in your body. It pertains to safeguarding your autonomy, your recollection, your capacity for speech, mobility, and your identity. Leonard once confided in me. Tears welling in his eyes, "Doc, had someone informed me that sleeping flat could yield such results, I would have altered my habits years ago." Allow me to be that individual for you today. However, if you find that alarming, consider the implications of sleeping face down, which can cause your neck to curve improperly, obstructing the arteries that supply blood to your brain. If you are still viewing and find these insights beneficial, please comment number 1 below to indicate your support. Let us go to the second point. 2. Sleeping in a prone position. Many elderly folks do a subtle error each night, one that appears pleasant, familiar, and seemingly innocuous. Prone sleeping position. You may have commenced this activity to alleviate back discomfort. You may appreciate the sensation of pressure on your chest or the feeling of being enveloped and secure. I am here to provide information that you may not have received from your regular physician. Sleeping in a prone position might pose significant risks to cerebral health. In medical terminology, it is referred to as the prone position. In youthful bodies, it may not do significant damage. As we age, our circulation diminishes, our arteries become rigid, and our oxygen levels decline more readily, particularly during the deep stages of sleep. Sleeping in a prone position might lead to several hazardous consequences. Your neck pivots abruptly to one side to facilitate respiration. This position constricts the vertebral arteries, which transport oxygenated blood from the spine to the posterior portion of the brain, an area that regulates balance, coordination, and consciousness. However, that is not the entirety. This position exerts pressure on the carotid arteries, particularly when the head descends into a soft pillow or mattress. Circulation is diminished. Veins intended to transport blood away from the brain become constricted. Stagnant blood accumulates, coagulates, and in susceptible individuals, it leads to the formation of thrombi. These clots may remain dormant for hours, awaiting the early morning increase in blood pressure, which can dislodge them and guide them into the brain. What is the outcome? A cerebrovascular accident. Frequently substantial, occasionally lethal. I will always remember Mrs. Ethel Lawson, an 82-year-old retired educator from Ohio. She approached me following a harrowing ordeal. Her daughter discovered her one morning positioned uncomfortably on her stomach, with incoherent speech and an unresponsive left side. Ethel was expedited to the hospital, where imaging revealed a significant ischemic stroke impacting her cerebellum, the region of the brain responsible for coordination and balance. However, the underlying reason was neither elevated cholesterol levels nor atrial fibrillation. Ethel's carotid arteries had become constricted with age, and the many hours spent sleeping face down with her neck contorted had diminished blood flow sufficiently to facilitate the formation of a clot. By daybreak, the harm had been inflicted. Ethel survived, however. She no longer operates a vehicle. She finds it difficult to walk unaided, and she informs me each time we meet that she was unaware that something as fundamental as her sleeping position might possibly jeopardize her life. This is the scientific explanation for it. In the prone position, neck rotation may obstruct vertebral artery flow by almost 40%. Particularly if the pillow or mattress pushes the head posteriorly. Chest compression may impede lung expansion, resulting in diminished oxygen saturation, so exerting extra strain on the heart and brain. Impeded airflow can elevate carbon dioxide retention, subsequently modifying cerebral blood flow and frequently resulting in vascular instability. With advancing age, our tolerance for fluctuations in oxygen levels diminishes. The natural response time of our body is diminished. A 30-year-old may awaken gasping and readjust, however at 70 or 80, the equivalent decline of oxygen may go unreported, quietly predisposing one to a nocturnal stroke. For individuals who snore, suffer from sleep apnea, or utilize sedatives or sleep drugs, sleeping in a prone position poses heightened risks. Your body exhibits diminished responsiveness, your airway is more susceptible to collapse, and the likelihood of a quiet, oxygen-deprived stroke increases. If you or a loved one habitually sleeps on the stomach, I strongly recommend transitioning to a side position with a firm cushion that maintains head alignment. Alternatively, sleep in a slightly elevated position on your left side to enhance circulation to both the brain and heart. These minor adjustments pertain not to comfort, but to survival. What may seem comfortable could be exerting lethal pressure on the arteries that sustain cerebral function. Additionally, consider that it is not solely the manner of your sleep that matters, but also the locations where pressure accumulates throughout sleep. Next, we will discuss a prevalent sleeping habit among millions of seniors, particularly those experiencing hip or shoulder pain, which might inadvertently impede blood circulation and result in nocturnal strokes. It occurs on your preferred side. 3. Slumbering behind a substantial blanket covering the head. A minor, profoundly personal habit that numerous seniors maintain into their latter years. A comforting, almost infantile action performed instinctively. We draw the blanket over our heads at night. It may serve to mitigate noise from a snoring companion or a buzzing fan. The space may feel drafty or excessively illuminated. Alternatively, akin to several individuals raised in frigid households, we discover a semblance of tranquility within that enveloping warmth and silence. However, for elderly individuals, this seemingly innocuous evening practice can subtly become fatal. Sleeping with a large blanket over your head not only obstructs light and sound but also restricts airflow. Throughout the night, oxygen levels decrease within that confined location. Carbon dioxide, the exhaled waste gas, accumulates around the nose and mouth. And while you are the same, reduced oxygen levels and elevated carbon dioxide during sleep heighten the risk of blood coagulation. In susceptible brains, it generates blood clots. Allow me to introduce Mr. Richard Hale, an 81-year-old retired postmaster from Iowa. Richard, a contemplative individual, consistently appreciated the sensation of slumbering in darkness. He informed me that he had been concealing himself under the covers since boyhood, as I observed. Particularly during winter, his wife playfully mocked him, remarking that he resembled a swaddled caterpillar each evening, yet it provided him with a sense of security and relaxation. Each evening, he securely wrapped himself in, drawing a heavy duvet over his head and snuggling into slumber. One morning, Richard remained in bed. His wife, concerned, discovered him lethargic and unresponsive. He struggled to open his eyes. Upon the ambulance's arrival, his blood oxygen levels were critically low. And a subsequent scan at the hospital indicated that he had experienced a quiet stroke during the early morning hours. A clot developed and became trapped in a tiny vessel deep within his brain. Resulting not from atherosclerosis or atrial fibrillation, but from oxygen deprivation during sleep, combined with age-related blood viscosity increase. Indeed, is one of the risk factors. Slumbering with little airflow beneath a substantial blanket. During deep sleep, particularly in REM cycles, the brain requires a steady supply of oxygen. While beneath the covers, inhaling recycled air, your oxygen levels decrease, prompting your heart to accelerate its rhythm, resulting in fluctuations in blood pressure. These fluctuations exert pressure on already delicate vessels. Incorporate mild dehydration, sluggish circulation, and age-stiffened arteries, and you establish an ideal environment for clot formation. Moreover, this is the alarming aspect. You may remain unaware of its occurrence. You retire for the night enveloped in warmth and security, yet your mind is gradually suffocating, and by the time the harm is inflicted, you may awaken transformed. If you awaken at all. Medical research indicates that even modest hypoxia, characterized by diminished oxygen levels during sleep, is associated with a markedly elevated risk of stroke and cognitive deterioration in the elderly. This risk extends beyond individuals with documented sleep apnea. It can impact anyone whose respiration is hindered by environmental factors or posture. If you habitually sleep with a blanket over your head, even during winter, it is advisable to reconsider this practice. Rather of adjusting the sheets, consider donning a sleep mask to obstruct light or utilizing earplugs to mitigate sound. Maintain your room at a nice, warm temperature and acquire breathable, lightweight bedding. This pertains not to discomfort. It pertains to safeguarding. Concerning the provision of essential oxygen to the brain for restoration, repair, and survival during the night. Strokes are not exclusive to others. They occur to virtuous individuals. Considerate individuals. Individuals such as Richard, who were unaware that a persistent habit might almost deprive him of his capacity to walk, speak, and retain memories. He currently utilizes a wedge cushion, ambient lighting, and his blanket positioned behind his shoulders while sleeping. He gently remarked, "I never realized that something perceived as safe could be so perilous." He is not solitary. What is unknown can be detrimental, particularly during our slumber. However perilous a heavy blanket over the head may be, it pales in comparison to the subsequent habit. Many elderly Americans depend on it for comfort. Nonetheless, it may impede cerebral blood flow, beginning with the manner in which you position your arm beneath your pillow. Allow me to demonstrate the process. If you are now viewing and deem these insights beneficial, kindly comment, number 1, below to indicate your presence. Let us go to point number 4. 4. Resting in an upright position within a recliner. Common among elderly individuals experiencing back pain. For numerous elderly individuals, sleep gets increasingly challenging with advancing age. Not merely achieving sleep, but maintaining it without pain or distress. Joint pain, spinal stiffness, gastroesophageal reflux, and dyspnea all point to a one answer: the reclining chair. It is possible that you are acquainted with an individual who has forsaken their bed entirely. Perhaps that somebody is you. Reclining slumber becomes a nightly routine. A plush blanket. The television emitting a pleasant hum in the background, the chair positioned optimally. It conveys a sense of security. However, what appears secure may occasionally harbor subtle dangers. As a neurologist, I have observed how the posture of sleeping upright on a reclining chair can gradually and imperceptibly elevate the risk of stroke overnight. The human body is structured to rest horizontally, allowing for uniform circulation of blood and oxygen. Sleeping in a semi-upright position, around 45 to 60 degrees, compromises the circulatory system, particularly in elderly individuals. In this context, gravity performs two functions. It draws blood downward from the brain and compresses the principal veins in the legs and hips. The outcome includes diminished blood circulation, accumulation in the lower extremities, and a significantly elevated risk of thrombus formation. This is less perilous in younger individuals. However, subsequent to the age of 60, the circumstances alter. Blood viscosity increases due to age-related dehydration. The vessels diminish in width due to years of degradation. The heart has diminished pumping efficiency. The sluggish blood accumulation in your lower extremities can lead to the formation of clots, which are small, adhesive, and insidious dangers that may migrate upward during the night or early morning. A single clot can become lodged in a cerebral vessel. The harm occurs prior to your awakening. Allow me to introduce Mrs. Barbara Keene, 79, a retired florist from Kentucky. An amiable woman with a keen memory and a gentle smile. She commenced sleeping in her recliner 5 years ago following a hip surgery that rendered lying flat excessively uncomfortable. She reassured herself that it would be temporary until the pain subsided. Nonetheless, the discomfort persisted, and eventually, the recliner transformed into her bed. She would awaken with stiffness but persevered, until one morning, her daughter discovered her still seated, disoriented and scarcely able to move her left hand. She experienced no symptoms or forewarning, nonetheless. A scan indicated that she had suffered a lacunar stroke, a minor, deep stroke resulting from a clot that had become stuck in one of the minute veins within her brain. She possessed no significant cardiac issue, nor atrial fibrillation. What she possessed was inadequate circulation resulting from years of sleeping in an upright position. Her legs would get edematous, her ankles frequently experienced constriction, and each morning, she would feel vertiginous upon rising from that chair. Upon reflection, the indicators were evident, yet, she, akin to many others, never conceived that a recliner could insidiously transform into a stroke hazard. Herein lies the medical veracity. Sleeping in an upright position diminishes the efficacy of the baroreflex, the body's intrinsic mechanism for regulating blood pressure. In a supine position, the brain and heart interact more effectively to regulate pressure, however, while in an upright posture, particularly if inclined forward or slightly rotated, this reflex diminishes, resulting in blood pressure instability, which poses significant risks for the elderly. Incorporate drugs, dehydration, or constriction from tight socks or edema, and you confront numerous risk factors simultaneously, all while believing you are merely enjoying a restful night's sleep. If you habitually sleep in a recliner or enjoy napping in that chair, regard this as your wake-up call. Sleep encompasses more than mere slumber. It concerns the alignment of your body to safeguard your brain. If you need to sleep elevated, utilize a hospital-style adjustable bed or a firm wedge that raises your chest without constricting your lower limbs, and ensure you stretch and move your legs frequently to promote circulation. Barbara now reclines in a bed once more, with her head up and a body pillow providing support to her hip. She frequently expresses that she believed she was simplifying her circumstances. I never believed I was exacerbating their risk. Many individuals presume that excessive movement poses the greatest risk. Nevertheless, for seniors, the true peril frequently lies in remaining stationary in an improper position for extended durations. However, if you believe a recliner may impede blood circulation, consider the consequences of sleeping on your preferred side with your arm constrained beneath your pillow. It appears instinctive and reassuring, nonetheless, it may constitute the most detrimental stance of all. I will elucidate the rationale. Sleeping on the right Side with an arm positioned beneath the cushion is the most perilous posture. A position that provides solace to millions, particularly among senior persons. It appears instinctive. It evokes a sense of security. You recline on your right side, position a nice pillow beneath your head, possibly nestle another between your knees, and, by instinct, place your arm below. You succumb to slumber, believing it to be the manner in which you have rested for decades. As a neurologist, I must inform you that this is the most perilous sleeping posture observed in the elderly. Not due to its painful effects, but because it insidiously impedes cerebral blood circulation nightly, perhaps elevating your stroke danger during the hours you presume to be at your safest. Repose. Let us analyze it systematically. When reclining on your right side, particularly with your arm positioned beneath your head or pillow, you exert direct pressure on significant arteries and veins in your neck and shoulder, notably the carotid artery and the subclavian artery. These are essential vessels, conduits for blood circulating to and from the brain. However, prolonged compression leads to a deceleration of blood flow, resulting in pooling, constriction of veins, narrowing of arteries, and in the tranquil state of sleep, stagnant blood begins to coagulate. It generates thrombi. The clot may remain in position for several hours until you move in the early morning. Your blood pressure increases at dawn. The thrombus is dislodged. It ascends. And within moments, your brain is deprived of oxygen. Allow me to introduce Mr. Ellis Randall, a 75-year-old Vietnam veteran hailing from North Carolina. Determined and fiercely autonomous. He often jested that he might yet surpass his grandson in speed. Each night, Ellis reclined on his right side, a habit he had maintained since his military service. He informed me that he would position his arm beneath his pillow for cervical support. One morning, his wife discovered him partially out of bed, disoriented and incapable of using his left leg. He was expedited to the emergency room, where imaging disclosed a right hemisphere stroke resulting from an occlusion in his middle cerebral artery. However, Ellis did not possess elevated cholesterol levels. He did not have diabetes. He abstained from smoking. What is the origin of the clot? Upon examining his habits, clarity emerged. Prolonged strain on the right side, coupled with years of resting on that arm, had impaired his vascular circulation. Ultrasound revealed stenosis of the carotid artery. Unbeknownst to him, his prolonged reduction in blood flow each night resulted in the silent formation of a clot, which manifested just before daybreak. Ellis endured, however his mobility is diminished. He currently ambulates with a brace and participates in weekly therapy to restore his coordination. He once said to me softly, "I was unaware that my sleeping position may reveal my true self." The reality is as follows. This position impacts more than only arteries. It also compresses the brachial plexus, a network of nerves that traverses the shoulder and extends down the arm. When that bundle is compressed by your body weight, the nerves do not merely become numb. They transmit distress messages to your brain and can disrupt your sleep cycle unbeknownst to you. Over time, inadequate circulation and nerve tension may lead to microvascular damage, which accumulates silently until it manifests. Older persons are particularly susceptible because to the stiffening and narrowing of blood vessels that occurs with aging. Blood exhibits increased viscosity. Restoration from constrained flow requires an extended duration. Nerve resiliency diminishes. If you have been sleeping on your right side, particularly with your arm positioned below, it is advisable to alter this habit. Not due to comfort, but owing to transformative repercussions. Consider positioning yourself on your left side with your head slightly lifted and your arms extended ahead or beside your body, avoiding placement beneath it. Utilize a tailored pillow to maintain cervical alignment and alleviate strain on critical vessels. A minor alteration could safeguard your autonomy, cognitive function, capacity to embrace your family, stroll your dog, or articulate your grandchild's name. Although you may not perceive the harm occurring, your brain retains the memory, your blood flow documents it, and ultimately, the body responds. What remains unknown throughout your slumber might significantly alter your reality upon awakening. However, if you consider resting on your arm to be perilous, anticipate the discussion of the implications of nocturnal restlessness and how such agitation may serve as a warning signal from your brain prior to an impending crisis. Allow me to demonstrate its significance. Frequent tossing and turning or poor sleep quality. A certain restlessness emerges as we grow older. The difficulty to maintain sleep, recurrent awakenings, and continual repositioning from one side to another. One might attribute it to typical age, arthritis, or the necessity to urinate. What if I informed you that this pattern of restless sleep could signify a warning from your brain and, more alarmingly, a potential trigger for a stroke? As a neurologist, I recognize sleep not merely as a means of rejuvenation, but as a vital period during which the brain restores blood circulation, regulates pressure, and eliminates toxins. Repeated interruptions of the process, particularly in older persons, can lead to profoundly detrimental repercussions. Each abrupt movement in bed, such as rolling over, repositioning your head, or adjusting your neck, momentarily modifies the cerebral blood flow. In a healthy individual at 30, that may be inconsequential. However, at the ages of 70 or 80, with rigid arteries, constricted veins, and delicate vessel walls, any movement can induce transient episodes of diminished circulation. Incorporate insufficient nocturnal water, diminished oxygen levels, or pre-existing blood pressure concerns, and your risk significantly escalates. However, what is more concerning is our emerging comprehension. Frequent nocturnal activity may not merely be a consequence of inadequate sleep. Your brain may be striving for equilibrium. Allow me to introduce Mrs. Nancy Delgado, a 76-year-old retired piano instructor from Colorado. She was consistently astute, refined, and meticulous, the type of woman who still pressed her pillowcases. For several months, Nancy had been awakening fatigued, despite believing she was obtaining 7 hours of sleep. Her spouse noted that she appeared to fidget incessantly in bed, shifting from side to side every 10 to 15 minutes. Initially, they believed it was merely a consequence of aging. Subsequently, the onset of headaches and early morning vertigo occurred. One night, she awoke with numbness in her right hand and impaired speech. Imaging in the emergency room indicated that she had experienced a minor ischemic stroke, perhaps occurring hours before to her awakening. What is the reason? The sleep study and vascular scan revealed a mix of inadequate sleep quality and intermittent hypoperfusion, characterized by transient reductions in cerebral blood flow during her restless movements. Over time, this erratic circulation resulted in blood accumulation in her cervical vessels, ultimately leading to the formation of thrombi. These clots were not attributable to elevated cholesterol levels or a cardiac disease. They emerged from disrupted, precarious slumber, the type that deceives one into believing they are resting while their mind is under assault. Nancy's narrative is considerably more prevalent than we realize. This type of interrupted sleep presents multiple risks, particularly for seniors. It inhibits the stabilization of your blood pressure, as adequate deep sleep reduces BP in a regulated restorative manner. It maintains increased cortisol levels, which can result in nocturnal blood pressure surges, a significant precursor to morning strokes. It impairs the glymphatic system, the brain's intrinsic detoxification mechanism, resulting in chronic vascular inflammation. It induces continuous variations in cerebral perfusion, the pressure required to maintain blood flow through the brain's fragile capillaries. These are not merely medical terminologies. These are preliminary indicators. And your body has been subtly signaling them to you throughout the night, awakening in a state of perspiration, breathlessness, or experiencing tachycardia. Your brain is indicating concern through sensations such as tingling in the hands, unbalance, or morning stiffness in the neck. These are not merely age-related inconveniences. They may indicate your body's need for improved sleep, posture, hydration, and circulation. What capabilities do you possess? Begin by regarding your restlessness as a symptom rather than a habitual behavior. Refrain from consuming coffee or alcohol late in the day. Maintain a cool and dark environment in your room. Use layered bedding rather than heavy sheets. Utilize a body cushion to support your joints and avert involuntary movements. Crucially, consult your physician regarding a sleep study if you or your partner observe frequent awakenings or excessive movement during sleep. Nancy currently utilizes a soft cervical pillow, maintains water at her bedside, and engages in slow breathing exercises prior to sleep. Her recuperation has been gradual, yet, she confides, I previously believed that awakening fatigued was customary. I was unaware that it constituted a warning I was disregarding each night. She is correct, as the body retains memories when sleep transforms into a conflict. However, there exists another insidious peril that collaborates with inadequate sleep, one that frequently goes unnoticed as it commences before to bedtime. The onset occurs when you neglect or deliberately omit anything essential, a prescription dose, a little pill, a basic practice. That may be the sole barrier between you from a transformative stroke. Let us discuss the consequences of omitting your cardiovascular or antihypertensive medications prior to sleep. If you are now viewing and deem these insights beneficial, kindly comment, number 1, below to indicate your presence. Let us proceed with point number 7. 7. For numerous older folks, the regimen of administering daily pills becomes instinctual, until the evening arrives when one neglects to do so. Alternatively, you may feel content and convince yourself that it will not be consequential this one time. The bottle may be empty, you might be fatigued, or you could be concerned about side effects, leading you to forego the medication intended to manage your blood pressure or regulate your heart rhythm. One overlooked dose, particularly prior to sleep, can become a latent threat during your slumber. For seniors, this peril may manifest as an irreparable event, a stroke that occurs overnight without any prior warning signs. I will elucidate the rationale. Your blood pressure exhibits a diurnal pattern, increasing in the morning and decreasing at night. This immersion facilitates the body's restoration. However, if you suffer from hypertension, atrial fibrillation, or any cardiovascular disorder, your body is unable to autonomously regulate this rhythm well. Medications are intended to ensure stability when your system is unable to do so. However, when you omit your evening dose, particularly if it is a beta blocker, calcium channel blocker, ACE inhibitor, or anticoagulant, a concerning event occurs. Blood pressure may elevate overnight, typically between 2 a.m. and 6 a.m., coinciding with the peak incidence of strokes. Your heart may accelerate or exhibit arrhythmia, and if your veins are already constricted due to age, cholesterol, or inflammation, that abrupt increase in pressure can lead to blood pooling, stagnation, and clot formation. Clots that remain active for a brief duration. Allow me to introduce Mr. Harold Green, a 72-year-old retired electrician hailing from Wisconsin. He was meticulous about his health, engaged in regular walks, consumed a balanced diet, and abstained from smoking. He experienced minor hypertension and was prescribed a low-dose medicine to be taken once daily at night by his physician. One evening, Harold was watching a baseball game, became engrossed, and neglected to take his medication. He reassured himself that it was inconsequential. He intended to take it in the morning, but he never had the opportunity. The following day, Harold awoke with an unusual sensation. His wife observed that his facial appearance had changed. He attempted to articulate, but the words eluded him. Within an hour, he was hospitalized, experiencing a moderate ischemic stroke. The physicians identified a little thrombus in the left hemisphere of his brain, presumably generated during the early morning hours when his blood pressure escalated uncontrollably due to the omission of medicine. The most unfavorable aspect? Harold was unaware of the immediacy of the risk. He presumed that a single missed medication would not cause significant harm. However, in older persons, whose arteries exhibit reduced elasticity and blood viscosity increases with age, it can serve as the critical threshold. Physiologically, this is the process that occurs. Antihypertensive medication functions by alleviating the strain on the heart and blood vessels. When the drug is omitted, the protective barrier is eliminated. Pressure accumulates. The endothelial lining of your arteries becomes inflamed. Platelets, the minute cells responsible for blood coagulation, exhibit increased activity. Where there is pressure and turbulence, a clot is prone to develop. In elderly individuals, the margin for error is minimal. A single missed tablet can distinguish between a tranquil evening and a transformative morning. Harold is undergoing therapy for recovery, but he adheres to a stringent pharmaceutical regimen. There are no exceptions. He possesses a pill reminder in his pocket and informed me during a follow-up visit that one night deprived me of my words. I will not permit it to incur any further expenses. Consistently administer blood pressure or cardiac drugs, including low-dose aspirin or anticoagulants. Establish a reminder. Request a loved one to conduct a welfare check. Maintain a supplementary pill organizer adjacent to your bed. At this juncture in life, your brain depends on routine more significantly than on memory. Moreover, it is not solely your actions that provide protection. It is your failures, even alone, that can negate years of endeavor. What if the threat originates not from within the body, but from the surrounding environment? From the frigid air caressing your neck during slumber? Due to the absence of support beneath your head? What occurs when one sleeps in a cool environment without adequate neck support? You may be astonished by the rapidity with which it can influence your brain. It is unrelated to comfort. Allow me to demonstrate. 8. Slumbering in frigid environments without adequate cervical support is commonly linked to enhanced sleep quality. The invigorating air, the cool linens, the manner in which your body nestles into comfort beneath a blanket, my mother, it is revitalizing. Numerous older folks lower the temperature, perceiving it as healthier or more energy efficient. What if that cold room, particularly when coupled with inadequate neck support, was causing more than mere discomfort? What if it was subtly constricting cerebral blood flow, narrowing your arteries, and elevating your stroke risk during sleep? Many seniors are unaware that temperature and posture during sleep significantly influence their vascular system. With advancing age, our body exhibits diminished efficacy in thermoregulation, particularly during nocturnal hours. Hypothermic conditions induce vasoconstriction, the tightening of blood vessels. This phenomenon is particularly perilous when it transpires in the neck, where two essential arteries, the carotid and vertebral arteries, deliver oxygenated blood to the brain. Envision your neck positioned at an improper angle on a plush cushion, or, much more detrimentally, lacking support altogether. The little misalignment, coupled with cold-induced vasoconstriction, diminishes cerebral blood flow. In an aging body, where veins have become rigid and blood circulation is diminished, this creates a perilous mix of reduced flow, blood pooling, and clot development. Allow me to introduce Ms. Loretta Dixon, a 78-year-old retired nurse hailing from Montana. She remained as astute as ever, brimming with anecdotes and cleverness. She consistently favored a chilly bedroom and slept with the window ajar, even during winter. She habitually curled up firmly, her neck slightly tucked under her chest, resting her head on a flat pillow. She perceived this as typical, even beneficial. One morning, she failed to awaken as customary. Her son discovered her semi-conscious yet incapable of concentrating her gaze. Her speech was incoherent, and she was unable to maintain an upright position independently. Hospital scans revealed a brainstem stroke, a notably perilous variant, induced by a clot in the posterior circulation. The region supplied by the vertebral arteries, which traverse the spine and neck. There was an absence of cardiac disease, no history of tobacco use, and no instances of missed medicine. However, one probable cause was continuous neck compression and cold-induced vasospasm during sleep. Over time, these two factors diminished blood flow sufficiently to facilitate the formation of a clot, which subsequently migrated to the most susceptible region of her brain. Loretta is currently undergoing physical treatment. She ambulates with support and experiences dysphagia, a poignant reminder that what we perceive as trivial discomfort can irrevocably alter our life overnight. Low temperatures constrict blood vessels. Inadequate neck support misaligns the vessels. Collectively, they subtly diminish oxygen levels to the brain, particularly during the early morning hours when blood pressure inherently surges. Insufficient oxygenation of the brain and restricted arteries can result in significant harm from even a minor clot. Additionally, there is a fact that many individuals fail to recognize. A significant number of seniors have varying degrees of cervical spondylosis. Age-associated alterations in cervical spine. The combination of inadequate pillow support in a cold environment significantly elevates the risk of diminished cerebral blood flow. What actions should you undertake? Maintain a cool temperature in your room, avoiding excessive coldness. The ideal sleep temperature for older persons is approximately 65 to 68 degrees Fahrenheit. Ensure that your neck is well supported. Utilize a medium firm cushion that maintains alignment of your head with your spine. Avoiding downward angling or excessive lateral rotation. Refrain from sleeping with your chin inclined towards your chest or your head tilted to the side. These minor modifications may appear trivial, yet they serve as protective measures, ensuring your brain is nourished during sleep. Loretta just informed me that she never anticipated something so trivial, the coldness of my pillow, could cause her discomfort. I was simply unaware. That is the most alarming aspect. A significant number of elders remain uninformed. They are engaging in familiar behaviors, practiced over many years, without recognizing that the aging body operates under distinct principles. However, at times, the peril does not reside in the sleeping position. It pertains to your actions immediately prior to closing your eyes. The final habit may be the most misconstrued. What occurs when one retires to bed immediately following a substantial dinner or excessive alcohol consumption? What effects do alcohol consumption and late-night digesting have on your heart, blood pressure, and brain during rest? Allow me to escort you there. This final factor may serve as the concealed catalyst that precipitates a crisis. 9. There is a prevalent assumption that consuming a substantial dinner and alcohol facilitates improved sleep. The sensation of warmth and comfort, concluding the day with a substantial dinner and a nightcap. It is a tradition in numerous American households. As a neurologist, I must convey information that you may not have previously encountered. Retiring to bed immediately following a substantial meal or alcohol use may insidiously precipitate a stroke that deprives you of essential faculties, speech, memory, and independence, before you are even aware of its occurrence. The aging body metabolizes food, alcohol, and stress distinctly compared to its previous state. What was once a source of solace may now pose a latent threat. Consuming a substantial fatty meal late at night, particularly one high in sodium or sugar, places excessive strain on your digestive system. Blood is diverted from the brain to the gastrointestinal tract. The reduction in cerebral circulation may not seem severe, nevertheless, if your arteries are already constricted due to aging, the ramifications can be considerable. Incorporating alcohol into the mix results in a volatile situation. Alcohol initially functions as a vasodilator. It dilates blood vessels. This explains why your face may redden or you may experience drowsiness following the consumption of alcohol. However, once its effects diminish, your vessels abruptly constrict once more. Elevations in blood pressure. The heart exerts greater effort to maintain stability. In elderly individuals, this sudden change can result in arrhythmias, significant fluctuations in blood pressure, and inadequate oxygen supply to the brain, all of which subtly increase the risk of stroke, particularly during sleep when vulnerability is heightened. Allow me to introduce Mr. Gerald Thompson, a 74-year-old retired agriculturist from Nebraska. Gerald, a guy of discipline and fortitude, derived pleasure from his evening ritual. Dinner at 7, bourbon at 8, and bedtime at 8:30. On a winter evening, he partook in a festive dinner consisting of turkey, mashed potatoes, gravy, pie, and his customary beverage. He experienced a sense of satisfaction, even pride. However, that evening, a transformation occurred. At approximately 4 a.m., his wife awakened to discover him cold and unresponsive. He was expedited to the emergency room, where a CT scan disclosed a substantial ischemic stroke in the frontal lobe, attributed to a clot that had developed and migrated overnight. The physicians detected no evidence of atrial fibrillation, no recent infections, and no missed medications. They discovered higher postprandial triglyceride levels, dehydrated blood, and constricted arteries due to alcohol rebound. The combination diminished cerebral circulation sufficiently to permit the formation of a clot, silently and lethally. Gerald endured. However, the stroke deprived him of his capacity for speech. His spouse, now serving as his full-time caregiver, conveyed to me tearfully, "We believed we were taking all the appropriate measures. We were unaware that supper and a drink might separate him from me." Digestion and alcohol vie for cognitive resources in the brain. Post-age 60, the digestive system experiences a deceleration, resulting in prolonged food retention in the stomach, which diverts blood from the brain for several hours. Alcohol exacerbates blood dehydration and may disturb the natural cardiac rhythm. The interplay of these two forces results in erratic blood pressure, promotes clot formation, and diminishes brain perfusion, particularly during the early morning cortisol spike when strokes frequently transpire. If you choose to consume alcohol, do it judiciously and preferably earlier in the day. After consuming a substantial meal, permit a minimum of 2 to 3 hours before reclining. Consume water beside your dinner. Refrain from consuming salty, greasy, or sugary items in the late evening. Do not confuse tiredness with restorative sleep. Alcohol-induced slumber is disjointed and detrimental to cerebral function. This does not pertain to the complete cessation of enjoying food or beverages. It pertains to honoring your body's requirements at this phase of life. You have exerted considerable effort to achieve a good quality of life. Do not permit a trivial meal routine to dismantle your accomplishments. The danger of a stroke often arises without pain or forewarning. Occasionally, it arrives subtly, enveloped in solace, masquerading as habit. Having identified the 9 most perilous sleeping habits that may elevate your stroke risk overnight, you might be contemplating what constitutes safe sleep. What modifications can I implement this evening to enhance my sleep quality and safeguard my brain for the long term? Let us consolidate all elements. I will guide you through the practices that promote healing rather than harm. Prevention commences with awareness. The capacity for change originates with you. Ultimate alert. Sleep transcends mere rest. It constitutes a safeguard. I appreciate your attention, not only for reading but for your commitment to comprehending the profound impact of sleep on brain health. Your recent acquisition of knowledge does not pertain to dread. It pertains to power derived from consciousness, from understanding the internal processes of your body while the world remains oblivious. At this juncture in life, information is indispensable. It provides protection. Every decision you make now, regardless of its magnitude, carries greater significance than it did decades prior. We have examined 9 inconspicuous habits that may appear innocuous. Comfortable positions, established habits, decisions driven by pain or exhaustion. However, each possesses the capacity to gradually and subtly steer the brain towards peril. Sleeping supine without a pillow, prone, in a chair, behind a heavy blanket, or on one's preferred arm, restlessly shifting throughout the night, neglecting medication, sleeping in a cold environment without cervical support, or retiring to bed with a full stomach and a glass of alcohol. Each of these factors, over time, establishes the circumstances for blood to stagnate, thicken, and coagulate. In a body already undergoing the natural alterations of aging, hardened arteries, diminished circulation, reduced oxygen, these clots are not just probable. They are probable. However, here is the paramount reality I can present to you as a physician. The majority of strokes occurring during sleep are avoidable. Allow that to be absorbed. They are not unavoidable. They are not arbitrary. They frequently stem from unexamined patterns, disregarded bodily cues, or comfort habits that have become obsolete with age. Therefore, if there is a singular message I would for you to retain from this, it is as follows. You retain authority. You retain the capacity to modify your sleep patterns, enhance your cognitive care, and safeguard your future. Sleep transcends mere rest. During sleep, the brain rejuvenates blood circulation, eliminates toxins, regulates hormones, and readies itself for the subsequent day. Sleep represents a period of heightened vulnerability for the brain, while it simultaneously offers an opportunity for restorative repair, provided one permits it. Commence this evening. Raise your head slightly. If possible, sleep on your left side. Provide support for your neck. Forgo the late beverages and substantial meals. Administer your meds consistently. Select breathable bedding. Ensure adequate hydration. Design a sleeping area that reflects your past experiences and the future you aspire to embrace. These alterations are not significant. These are nuanced changes, yet they possess significant importance. In a world replete with uncontrollable factors, this aspect of your health is significantly influenced by your choices. Each night, you are not too advanced in age to undergo transformation. You are not excessively advanced in your situation to safeguard yourself. It is never too late to acquire the skill of sleeping, not solely for comfort, but for survival. As I frequently convey to my patients, the emphasis is not on the duration of sleep, but rather on the quality of sleep. This evening, as you remove the covers and rest your head, consider whether your sleeping position is beneficial or detrimental to your brain. By safeguarding your sleep, you safeguard all aspects of your well-being. Your oration, your recollection, your equilibrium, your autonomy. You safeguard the fundamental nature of your identity. Such an endeavor is invariably worthwhile. These lectures aim to motivate you to live completely and truly. I would appreciate your feedback. Contemplate and articulate one lesson acquired that you intend to implement in your life. Let us assist one another in this endeavor to accept these truths. If you appreciated this video, kindly leave a comment with 1. If not, please feel free to remark with 0. Your comment is highly valued by us. Please remember to like, share, and subscribe to our YouTube channel for other stuff of similar nature. Thank you for viewing, and may you embrace life according to your own principles.